have the influence from pharmaceutical companies, which is so strong because they fund the CDC, the AMA, the FDA, right? Those various organizations have funding into them. So all the guidelines that come down from the top that land on every physician's desk or computer are essentially funded by pharma.
First of all, what got you interested in health? And specifically, what got you interested in pharmacology?
Well, actually, when I look back and you're 18 and you're deciding your plans for your life and you're young and immature, I might have done things a little bit differently. But in high school, when I was younger, I was really fascinated with the body, with chemistry, with biology. And at the same time, I hated blood and guts. And so, makes me nauseous. So I was just like, I'll go into medicine, maybe pharmacy, something like that. And yeah, the rest is history. I definitely would have done a different path, but now I'm very thankful for it because sometimes it's the choices that you make that show you something that you would have never known otherwise that actually got me interested in health.
Yeah.
So I've always been, I would say, a very healthy person, played, competitive sports all through my childhood. My husband and I did, Ironman. We were, adults, very much into health, but it was my just being embedded in the healthcare system where you actually understand true health versus what's going on today in society. So yeah,
I had no idea that would be the answer. It's just kind of like you want to get into health, into medicine, but just like, let me avoid all the cutting open and all that stuff, but find a way that I could serve. And so what was your life like day to day, having a doctorate of pharmacy? What was your day-to-day life like, and was it what you thought it would be?
Well, I honestly don't know what I thought it would be, but I actually wasn't your normal pharmacist. I only worked in a pharmacy for 1 month of my entire life, and that's when I had to in school. And I hated every minute of it, and I felt like I couldn't actually help anybody or talk to anybody, and nobody didn't seem wanted to listen to what I had to say. So through my education, I actually learned about how dangerous prescription medications can be and how they are like the fourth leading cause of death, just, death from prescription medications. And that was so saddening to me. And that after I graduated, I was like, I want to make a difference there. Like, I want to be somebody who helps people maybe get off their meds and do it right. And so I pursued a residency in medication safety. And from that point on, my day-to-day was, in my first kind of gig in my career, I was just coordinating a lot of processes and projects on reducing medication error. So that looked like a whole lot of things in a large clinical system, whether it be, reviewing, death from medications or reducing opioids or, developing a safer processes with physicians, educating physicians, things like that. And then we did a study, which was awesome, but really got deep into how patients are just buried in medicines, essentially, and lost in the healthcare system. And that was kind of my really seeing up close how patients are, get put on 5 meds, which leads to 10 meds, which leads to 15 meds. Then they're hospitalized, put on different meds. And so I was dealing with that mess in my first part. And then after that, I became a director of safety and quality for the Hospital Association. And that was more working on a macro level with the federal government and with hospital leadership to reduce antibiotic utilization, safer use of antibiotics in the hospitals, reduce med error, reduce death. So my day-to-day there was just working with hospitals across our region and physician presentations, all sorts of things. So
wow.
Yeah.
So you made the pivot into safety once you found out, hey, there's some potential issues here with our hyper focus on pharmaceutical interventions and patients being on a lot of different medications at once. It's polypharmacy phenomenon.
Yes. Yeah.
And from that, working in safety, you were working in a little bit more on the education side, like you mentioned, with educating physicians, for example. Now, being in that structure where pharmaceutical medication and really pharmaceutical industry and companies have a major influence on education for physicians as well. So
Right.
what was that like, trying to have these conversations, trying to basically combat all the influence from pharmaceutical companies?
Right. Yeah, it was kind of twofold in that regard. So you have the influence from pharmaceutical companies, which is so strong because, they fund, the CDC, the AMA, the FDA, right? Those various organizations have funding into them. So all the guidelines that come down from the top that land on every physician's desk or computer are essentially funded by pharma. And so to make recommendations that might veer off guidelines based on other evidence that is not presented by pharma or the CDC or you name it, is a challenge because physicians have a hard time going off of guidelines. They can even lose their job. So on one hand, you would see impact made and you would see decisions change and you would see systems, adjust and all that. And there are providers who want to change. But on the other hand, most just aren't willing to sacrifice their job, or hospitals literally have to obey to who funds them and reimburses them, which is the government. So they're not going to necessarily do anything that messes that up or they'll lose their funding. And so after a while, you realize this box that you're in, that you can kind of make some dents in it, which was great, but you could never really get out of it. So there's that. And then there's also just the simple fact that physicians and any human, it's hard to change something when you've been doing something for so long, or when you've trusted somebody for so long, 20 years, 30 years, or you've just come out of med school and it's like, well, this is what I believe to be true. And so you're also working just with the human race that has a very hard time with change. Yeah. And that's a large component. It actually takes 17 years for a change in the healthcare industry to come to fruition. So if some major announcement came out today, safety concern or whatever, and the federal government's like, okay, this is something we have to do about it, starts working on it with healthcare, 17 years later. So it's an incredibly clunky and slow process.
Wow, that should be pretty sobering.
It is.
17 years. That's basically, the time it takes to get your driver's license from somebody being born to get that time for the education to change, really, and that's what it really boils down to, is what are students being,
yes,
and not to use this word lightly, but indoctrinated,
yes,
with a certain way of thinking. And if they're getting educated, and we're taking very smart people, brilliant humans, and teaching them a way of thinking that is dramatically outdated and oftentimes not effective,
yes,
we have a absolute army of folks who are doing things that are ineffective.
It's truly a crisis, and I think that indoctrination is a perfect word. And I mean, that was me. That's literally everyone that goes into a medical profession. I mean, after I started peeling back the layers and doing my own research and putting a lot of pieces together and connecting the dots, I realized how much you become completely indoctrinated, and things that I used to believe to be true are completely false. And that could be because of financial bias. It could be because of funding. And it also could be because it takes a couple decades for things to get around for a script to even change.
Yeah. Where we're at with science today, obviously the cutting edge science is really centered around circadian medicine, epigenetics, and all of these phenomenal things. Again, I've known about these things for almost 20 years.
Right.
And, with circadian medicine, maybe 10 years, but, epigenetics, almost 20 years. And still, these are just beginning to be talked about and implemented in the conventional, like more of a mass scale.
Yes.
And so, again, just what are we still doing that's out of date, and what are we missing out on that can actually be helping folks? I want people to think about that a little bit. And I want to ask you a little bit more about something you said earlier, because it can be easy to glance over. One of the things that was eye-opening for you, which, again, you're coming into this wanting to help folks, and then coming across some data indicating that pharmaceutical drugs, really the thing that you focused on in your education could potentially be the 4th leading cause of death for citizens in the United States.
Yep, it ties with stroke. And I honestly think if the estimates say it's 125,000 a year or X number, it's probably 10 times that, because we don't really even have reporting systems for
that's the thing.
that. And
it's
so
not accounted
these
for.
estimates are honestly so low. I mean, if someone has a stroke, you know they had a stroke. But if someone dies from their prescription meds, it's not necessarily put together. So yeah, I mean, prescription medications, I always like to preface a lot of what I say with, they have a role, especially in, I believe, acute care. But the way we use them today to essentially mask what is going on in people's bodies, the symptoms go away, but then they get 5 new symptoms, because the way a drug works is it's just setting off a chemical cascade of reactions. So, you know, when a patient takes a drug for, let's say, blood pressure, yeah, it's going to impact their blood pressure, but it's going to impact probably 100 other things in the body. Right. So I don't even think of them as side effects. I think of them as expected effects of a chemical that we're putting on our bodies. And so when you do that, and then you have new side effects or expected effects, and then 5 more drugs, and then pile onto that, you're going to have, the body system is so dysregulated and it's not functioning as it's designed, and there's drug interactions. And so you can imagine how easy it would be for a person to die from that. It's not even functioning like, you know, the neurotransmitters, the hormones, all the things that can't function like they're designed, when there's so many other chemicals at play. So yeah, it's tragic.
And we'll put this up for everybody to see. What you mentioned, around 120,000 folks passing away each year. This is properly prescribed medication. Mm-hmm. But then in addition to that, you know, other issues mm-hmm. with pharmaceutical drugs. The EJS Center for Ethics at Harvard University revealed that it's about 200,000 folks pass away each year from pharmaceutical medications. And I want to reemphasize this. This isn't something that you go and look up on the CDC site. Like, here's the list of causes of death in the United States. No. That's not being advocated or tracked or being disseminated to the public.
Did not see it on a billboard outside. I saw a lot of advertisements when I was waiting to come in, and that was not one of them.
Yeah, it's so crazy that's even a thing. And so these researchers are literally just digging around. They're working their behinds off mm-hmm. to go and find this data. Yeah. Because, and what they noted in that report was that the FDA only acknowledges a fraction of the cases that actually happen.
Right. Yeah, there's not funding. There's not time and personnel and funding to even begin to track the mess that it is.
Why do you think that's not being tracked?
I mean, it doesn't go with the narrative, so there's that. I mean, the CDC, the FDA, the AMA, the AAP, the American Academy of Pediatrics, they all receive funding from pharma, and pharma makes billions of dollars. So to kind of advertise against that would maybe cause some wrestling. I mean, I can only postulate, right? But we've become a very pharmaceutical-centric nation. I mean, even the system we have, VAERS, we could really amp that up. We could really talk about it. We could let physicians know about it, let people know about it. But it's not priority. But that doesn't add to anybody's wallets. It just helps people be aware of what's going on. So
that's basically, you know, if we're wondering why it is the way that it is, it would be biting the hand that feeds you. Right. Know, when we're talking about literally the CDC being funded by the pharmaceutical industry, the FDA, to the tune, we're talking billions of dollars. Mm-hmm. And we've allowed a system to be created that would be very difficult to point out the underlying fallacy of the system. But for me, I'm a big proponent, and you know this, of just like, let's look at the results. Right. Let's look at how things have transpired in our society right now. How's it working out?
Right. People are not doing great, right? I mean, we are sick as we've ever been. We're literally only getting sicker as we are coming up with new novel drugs and new biologics and new advances. I mean, so much of modern medicine is, quote, advancing us, but we as humans, as humanity, are not advancing. We're degrading, you know, we're so sick. And that is what drives me, is I want people to actually heal.
I want to ask you about something that I think quite a bit about, and I've talked about a little bit, but having you here is such a great gift because I can ask you about this. what does a situation really look like as far as drug approval and drug recall? There are obviously a tremendous amount of drugs that get approval from the FDA, our big stamp of approval of safety.
Right. And
most folks have no idea that a incredibly high percentage of those drugs get recalled for various safety issues. So let's talk a little bit about that.
Sure. So as far as drug approval, so the pharmaceutical companies are the ones that invest all their money into, running the trials, pour in hundreds of millions of dollars just to bring a drug to the FDA to get approved. Then the FDA is relying on the pharmaceutical company to tell them, here's our results of our trials. So it's a red flag.
It's like grading your own homework.
Yeah. So we spent millions of dollars and here's what we found out. I'm laughing because it's ridiculous if you really think about it. So then the FDA then, puts its stamp of approval, yay or nay. But there's kind of this backdoor thing too, where the pharmaceutical company kind of pays them later after it's a user fee.
And post hoc, yes. Post hoc payments.
So, the money goes in. And so I think it's just the whole system is flawed in that you have the pharmaceutical companies running it. It's not like a third party situation where everything's blinded by the company. And then the FDA approves, and they actually approve the majority of drugs that are brought to them, and they also receive a lot of funding, of course.
Go figure.
And as far as the recall, that's actually one of the first things that kind of woke me up. I was, I think, first year pharmacist in my residency, sign up for all these listservs, get all these emails every day. It's like every day, emails, drug recall, safety alert, that like every day. And I realized so quickly that drugs that are approved as, quote, safe and effective 2 years later, 4 years later, 6 years later, have a deadly effect on people. Cancer, maybe it's stomach acid reducers in cancer, or, antidepressants actually can make you suicidal. These things come out, recall after recall after recall, and the issue is it just takes time. Right. And what I realized is that you have the clinical trials run by the pharmaceutical company that are looking for specific outcomes, right? They're looking for a specific change from the intervention. Like, did the person's mood get better? Did their reflex improve? But to understand the full-blown picture is not being captured there, right? And so I always say that we, the people, are the clinical trials. So when you take a medication, you are the clinical trial, because there's no way it's covered in the clinical trials done by pharma, and those are short anyways. And so it really just takes time. Every drug will ultimately have something, even ones that I learned in school. It's like, oh, Lipitor is so benign. Basically, everyone should be on a statin. That was just preached hardcore. And I was indoctrinated in statins, and many people still are. And now there's plenty of reason to not use that and to even understand cholesterol in the first place. But yeah, it's really a timing issue, and there's such a financial bias, and the reporting system is flawed, which is another element to why it takes 10 years for something to come out, down the road. So
yeah, that's bananas. And speaking of Lipitor, there was a time when, I was working in my clinical practice, and I had people coming in, and it was the most widely used drug I had ever seen. All of a sudden people were just on statins. It was getting passed out like candy because it seemed to be so benign. But I came across this data, and it's so crazy that I'm even talking about this still to this day, that we saw early on about a 30% increased incidence of somebody developing diabetes once getting on a statin. And I'm just like, there's something here. It was so benign. There was even talk and litigation being pressed through, and this might sound absolutely nuts, but like putting statins into the water supply, because
they actually are in the water system.
Right.
Filter it.
They are, right, because of us. So, and here's the crazy thing, if you think about it, fluoride is added to the water supply as a treatment,
Right.
And it's kind of like you don't have informed consent. Like, do I want that treatment? What is the side effect of that treatment? How much should I be consuming of this particular supplement?
Yeah.
And the same thing with statins. Again, it seems so benign, but if it's superficially lowering your cholesterol, what are the other mechanisms that it's influencing? And you said this earlier, it's influencing like 100 other things at least.
Right. And that's literally every medication. So, you could take something like Lipitor, you could take something like NSAIDs, ibuprofen. It's like, oh, this is awesome. I don't feel my pain. But it's actually impacting prostaglandin and the COX enzymes, which are protective for our stomach lining. So you're helping pain, but then you're breaking down your gut, which leads to basically infinity issues. So, you could apply that to pretty much every medication, but it's especially frustrating when we've all been indoctrinated in the fact that it's benign, it's safe, this is safe. Pretty much everyone should be taking it.
Right. I would think that, in a logical world, which
it's a dream.
I would think that our FDA, Food and Drug Administration, this regulatory agency to protect United States citizens, would at least do some third-party testing. So you get this data from the pharmaceutical company. They've run their particular thing and they told you this is the result. Let me see. Let me check on that and run the experiment, because that's one of the things about real experiments is that they should be replicatable.
Yes.
Very simple. Like why can we not do that? Because on the back end, we can be literally saving millions of lives.
Millions. And not only lives, but there's a lot of just harm and quality of life that's lost too.
Right. Yeah.
Through taking these medications. So
that's also what's not talked about, because that's pretty hard hitting.
But
Yeah, but we don't really look at all the people injured, millions a year, and also how that affects their families, how that affects their ability to make income, just
injured and not healing too. You can cover up a symptom, or you can be like, okay, well my blood pressure is better, but you're actually still very sick. You don't have energy, brain fog, hormone issue, all the things, because you didn't actually heal the problem in the first place. And then you can't actually live your life freely, full of energy, right? So
that's another part that I'm so glad you brought that up. When we say a figure like, again, the EJS Center for Ethics at Harvard saying 200,000 folks pass away each year from pharmaceutical medications in the United States, we're not actually looking at how many people die as a result of inadequate treatment.
Yes.
Right? So somebody has heart disease or diabetes, and instead of them actually being helped, let me remove the cause.
Right.
How many millions of lives do we lose because they're not actually being treated?
Right. They actually aren't given the tools to actually be their own doctor, right? To learn how to actually be their own healer. Who could actually go see someone once every 3 months and expect that person to literally change their life? They can't, right? So what happens is they're given medications because that's quick and that's easy, and doctors are even incentivized to get patients better quicker. I can talk about that a little bit, but quick is usually by pharmaceuticals, but patients are not given the resources and the tools and the basic foundational concepts like, hey, you can actually do this on your own, and you don't need to take the risk of these medications because they could actually lead to your death quicker. Like, let's do this the other way around. Let's and maybe take some labs. Let's talk about food. Let's talk about movement. That's just not the paradigm of healthcare, unfortunately. So
yeah, let's talk about this with our physicians being incentivized.
Oh, yeah, it's an interesting component. It's like value-based insurance, value-based incentivization for physicians. The idea of it sounds great. It's like, hey, Joe has diabetes. If you get Joe better in 6 months, we're going to reward you. We're going to reward your clinic if all of you do this right. More financial reward. The issue is that system just pushes meds, because most people can't hit the targets that they need to be hit in 3 months based on lifestyle alone, right? If you take that pill, you could see your blood pressure go down in a week. I mean, I don't know, right? But to get someone to truly change and heal is not med dependent. And so even parts of the healthcare system that at surface level, like, okay, I like that idea, it still is pharmaceutical centric and not patient centric, which I was in healthcare for 10 years, ended up at a very macro level, worked with a lot of people in high ups, and it was always said the patient needs to be the center of the care. it's like there's all these diagrams. You have the patient in the middle of it, and then you have all the things around it, like medications, insurance, pharmacists, physical therapists, all these people, and the patient is in the middle. But that is literally not what happens. It feels like pharma is in the middle of it, and we're all just kind of out there on that wheel spinning around. So,
wow, that is a crazy visual.
Yes.
Let's talk about that. Your work for several years, working essentially with the CDC being an influential factor, and you being, a point of contact, and working along with that entity. Again, the CDC is who everybody's looking to today for our advice about the issues going on in our world right now with this particular virus. Let's talk about that aspect of work, because you mentioned this is like a macro position where you can see more aspects of the government and influence with our healthcare system.
Sure. So I worked a lot with CMS, the Center for Medicare and Medicaid Services, and they provide a lot of this reimbursement mechanism for hospitals to do what they want them to do. Not all of it is bad, but it's all very orchestrated. And then I also worked with CDC, and, I'll just give an example, and this was a very illustrative point to a lot of what I was exposed to. So I was involved with reducing antibiotic use because antibiotics, as we know, great when you need it, terrible if you don't. And I was at a conference, an infectious disease conference, with tons of physician leaders, the CDC there in their, outfit, and, federal leaders, local leaders, physician leaders, and also pharma, all out in the lobby with all their tables. Anyway, so I remember during one of the presentations at this conference, the CDC was presenting on the flu shot, actually, and they were talking about, this is the data, this is what we know, but this is what we tell patients, and this is the kind of campaign. So it felt like it was kind of just like brushed under the rug. This is what we know to be true. This is, the standard. This is the new strains, yada, yada, yada. And then here's what we tell patients, and here's how we get them to take the shot. You really need, it was all about persuasion, talk about grandma, talk about baby. And it was so fear-based and so not evidence-based. And in that moment, I was like, this is it, loud and clear at a conference, and full of all of us there sitting, and physicians. And I don't think anybody had a problem with it, because most people believe it's the right thing. It's just what you do. I don't think everyone is like me and thinks, hey, like this is a major red flag. But that is where I fully realized, and I actually spoke up at that conference over that statement and a few other ones, and just pointed out various other pieces of evidence, concerns. And what I found so fascinating is that the CDC and the physician leaders literally couldn't answer me and had no thoughtful, educated response until like, hey, that's so true. I've read about that data. Here's the flaw in it. No flaw in it. Just we're not talking about that data. And so I really just learned that, pharma was there at the conference with the CDC, and it just felt like this gathering of people where the guidelines were predetermined. We weren't talking about evidence. We were just talking about how we were going to get patients to do what we want them to do. And, I think the fact that no one wanted to address any of my concerns, I was even pulled aside after it, like, hey, we're going to talk about that offline. Try to set up a meeting with them, never wanted to meet with me. So I think it's this tunnel where guidelines are determined, and when you're funded by pharma, the guidelines are going to meet those needs. And so it kind of goes back to, this wasn't patient-centric, which is what I raised. And so while the CDC, there might be some good intent there, unfortunately, I think they are so deeply indoctrinated with the people creating the medications, the biologics, that the guidelines are literally, it just feels like to me to serve them, and any piece of evidence that does not align is not invited. So, and that to me isn't science, and that to me isn't medicine. It's not ethical. And I truly think that all of us as individuals and the American people truly deserve something better than that.
Yeah. Wow, that's powerful. That's really powerful. And, even in those moments, you're standing up like Jerry Maguire in this scenario, like, who's going with me? Who's going with me?
I know.
And even though everybody's like giving you kudos, like, yeah, that's great. Good question. But they're already so concerned about their own thing. They're not really hearing and seeing the red flag.
Yeah, definitely no kudos. It was more of like silence. I mean, I don't think people in these positions are ever used to being challenged to even consider like another perspective or consider. And I think in that moment, in that conference and throughout my career, I came to realize that we're not paying attention to a patient's whole health. Right now we're talking about infectious disease, and you're talking about one infectious disease in a field of infectious diseases, and infectious diseases are one part of the of health and of the earth, right? And so I was talking about the bigger picture and how, well, what if this is impacting the patient's whole health? There's so much more than just this infectious disease, and that's what really drove me actually to create my account with the phrase whole health in it, because our bodies are, we're so much more than just a diagnosis or, whatever label we want to put on whether or not how we are interacting with the virus of, modern times. So
I just feel like it's such a visual representation. Like I feel like I'm there with you.
Oh my gosh.
At this conference.
I recorded myself. I was like, it was like a defining moment.
Yeah. Well, thank you so much for doing that and stepping up and having the audacity to question these things, because, throughout history, it's always those people who are, in a sense, non-compliant and non-conformist to a system or an industry or way of thinking that brings us to a place where clearly something is not working, something's not aligning. And with it being the case in this convention, again, we're talking about infectious disease. We're looking at the flu right there in that scenario. And we're looking at how can we get everybody to take this drug?
Yes.
And negating this fact, and this was from a review of multiple studies. This was published in the American Journal of Infection Control. And the study was titled, quote, "Lack of sleep can jeopardize vaccine effectiveness," unquote. And it highlights one of the big components ignored in our healthcare system, which our sleep is such a major modulator and controller of our immune system.
Yes.
Like it might be the most powerful regulative instrument. And so this study, along with several others, suggests that vaccine effectiveness against infectious disease may be impaired in sleep-deprived individuals. And to take this a step further, researchers at University of California, San Francisco found that sleep-deprived individuals who were sleeping less than 6 hours per night were over 11 times less likely to be protected by a vaccine than those who got adequate sleep. Again, if we're talking about influenza, for example. And no study's perfect, of course. But when we have data like this, why at the conference are we not talking about how, hey, we want to coerce everybody into taking this drug.
Right.
How can we make sure that it's actually more effective?
Right. Right. So, yeah, and it's really that there's kind of two layers to that, because number one, there's what you're talking about is it effective, and are there alternative ways to do this without the drug, to actually just create a strong terrain through sleep, food, movement, all these things, right? What you talk about all the time. And then the other component is simply omitting the basic fact that the product that they're trying to get everyone to take, age 6 months till you die, doesn't prevent transmission. So there's number one, the effectiveness, which is actually incredibly small. I think it reduces symptoms by like a day in like one age group of people, men. But also the whole campaign was based on, hey, you're doing this to love your grandma. You're doing this to protect your baby. And that effectiveness was not there, but that is what the entire campaign was on. And so that's what really frustrates me, is you're omitting data like you're talking about, other ways to meet the goal of healthy people, because that's the goal, right? Healthy people living their life. And then also just integrity and honesty. And I don't know about you, but when I hear something that is not honest and people being okay with it is like driving me.
Yeah, definitely. I definitely feel the same way. And here's the thing too, and I want to talk more about this. A lot of the folks in that room, or just in the healthcare system, period, we get into the field to help people.
Yeah.
It's an altruistic driving force. Now, with that said, again, being a very smart person who's driven to serve and to help people, and we're taught a certain way of thinking, suddenly we're swept up into this alternate reality where we believe that this is the way that we make the patient first, right? The patient is the center of the chart, but in reality, it's not the patient who this is all about, except in many ways, they're a customer now, right? And we're in a system where how can we keep this person, and unfortunately, on as many different modalities of revenue for us. You know, we have a system that is based upon and exists. It only exists because we have a farming of sick people, essentially.
Yes.
You know, if we have more healthy citizens in the United States, this system would rapidly fail. Overnight.
Yeah.
So with that said, I want to circle back and ask you about something. I don't want to brush over this. You mentioned antibiotics earlier, and you said essentially antibiotics in the right circumstance, great. Antibiotics used in different or wrong circumstances, not great. Why is that?
Well, antibiotics are really great at their job, which is to kill bacteria, right? And so if you are severely, acutely ill with a bacterial infection, this is when antibiotics shine, and we're all thankful for them in that situation, right? But they just, unfortunately, while they're wiping out whatever's causing you to be sick, they're also wiping out your bacteria in your gut, which is literally basically just made up of bacteria. And so when you wipe that out, your gut it's our second brain, and it drives basically everything in our body. So nutrient absorption, mood, allergies, energy. I mean, any physiological process, you can probably relate back to how the gut impacts it. And so unfortunately, when you take a course of antibiotics and you wipe out your gut, when you do that chronically, your gut microbiome becomes so dysbiotic that kind of the bad bacteria take over, even fungi. Then you get leaky gut because that fungi actually poke a hole through your intestinal wall, which is 1 cell thick. And then that's when, food particles get in, toxins get in, all the things kind of get into your bloodstream that your gut's supposed to be protecting. And that's when you get major issues. And then on top of that, I would say too, the antibiotics, well, there's a lot of that I could say, but your immune system is housed in your gut. And so it's kind of ironic because you're like killing the bacteria that you want to be gone, but then you're also basically killing your immune system for the time being. So it's just an ironic situation that takes place there. And then another layer to antibiotics is they're so misused. I think there's 47 million inappropriate antibiotic prescriptions a year. And I mean, 35,000 people die from drug-resistant infections from these superbugs. And I think it's because there's so much overuse of these antibiotics. And think about the ramifications that come with 47 million inappropriate. And up to 50% of antibiotics are either inappropriate or just incorrect, like wrong drug or wrong dose, or just we did not need those at all. Maybe it's a virus or something like that. So the ramifications on society are just that we're essentially completely damaging our gut, which drives our health. And on top of that, we're creating these terrible resistant superbugs. Like, I think by the year 2050, 10 million people are going to die a year from these drug-resistant superbugs. Yeah, it's one person every 3 seconds by the year 2050. Because as a society, drugs are our answer, and we love a quick fix. And when we're sick, we want antibiotics. We want the Z-Pack, and people don't want to wait. And so because of that, we're just driving the evolution of superbugs. And, bacteria are smart. Viruses are smart. If you put something in their path to conquer, they will mutate and conquer it and become more virulent. So
that's kind of creepy. That's kind of creepy,
and
we're assisting in that happening.
Yeah.
That's the craziest thing about us, about all this. We shouldn't necessarily be worried about a comet or something of that nature, a Bruce Willis Armageddon situation, more so than us creating a scenario where we are not able to exist here by us tinkering with things. And there's even some data on antibiotics being prescribed to patients with COVID-19.
Yep.
This was going on a lot. It probably still is in some scenarios. But again, it's just like here you have this a certain list of symptoms. It appears that here's this antibiotic.
Well, and you know what? I think that goes to show too the gut health of Americans. It's so bad. So I think there's the microbiome of our gut is impacting how COVID-19 is interplaying with our bodies and causing various symptoms. And so I think when they're giving patients those antibiotics, it is impacting how they're responding to COVID because of the interplay between the bad bacteria that are being housed in these patients' gut and the virus and being host to them. There's very interesting data on it. And so I think to me that was just showing me the very strong influence of the gut biome with COVID-19. And I think it's another example where you can look at a person and say, hey, they're healthy. Why are they having those outcomes? Maybe their gut was completely destroyed by antibiotics or by toxins. So their bacteria is off and it's impacting their response to COVID-19. And there's a lot of data around that. It's very fascinating.
Well, this brings us back to this important point, which is, again, looking at the gut, which this is another one of those cutting edge places with science today.
Right.
And understanding just how much. And the crazy thing is, goes all the way back to Hippocrates. Right? Yes. He was like, all disease begins in the gut.
Yes.
Forget it.
Totally.
You know?
Quack. But he was conspiracy theorist.
In our system, we took it's the Hippocratic Oath, based on this fella's work, and his insight. Mm-hmm. But with that being the case, in this instance with COVID, and I've talked about this, I've really done some master classes looking at this. BMC Medicine, we'll put this up for everybody to see, articulated that COVID-19 is at least partly an enteric infection. Mm-hmm. Where it's integrating with, we've got these ACE2 receptors where, this kind of bridge where SARS-CoV-2 is able to infect human cells. There's a lot of action with this particular enzyme, that activity in the gut. And so the researchers were looking at how things like proton pump inhibitors were increasing the incidence of severe infections with SARS-CoV-2. Yes. And again, we see this data. It exists from some of the most prestigious journals, but unless it's a platform like this, you're just not hearing about this kind of stuff. And it goes back to logic and the things we've been talking about, yourself included, for years now. How can we get people healthier? How can we really target and help the health of their gut so they're not as susceptible to infections?
Right. Yes, exactly. I remember posting about the PPIs. I was like, this is huge. And, people just don't care. But I think it just goes to show you PPIs. I mean, those are one of the most commonly used drugs in Americans because we eat terribly as a society. So therefore we have reflux and gut issues and all sorts of stuff, heartburn. So people take those medications all the time and they reduce the stomach acid, which we need in our stomach for a million reasons. And so unfortunately, it's just like an expected effect. Oh, you're getting sick because your stomach acid is not doing its job. So
yeah, it's such a backwards way of thinking, and I've got a very specific experience with this. I would never have heartburn in my life growing up, never had it, except when I ate this one particular thing, which was the 7-Eleven nacho with chili and cheese. All right. And whenever I would eat it, I would get this really terrible feeling, this nausea and heartburn. But I kept going to get it, I was just I loved it going down, it was such a great experience, which I've talked about this before. I mean, going to 7-Eleven and getting your meat out of a pump.
Oh my gosh.
It's probably right there, off the bat. It's probably not a good idea.
Maybe.
And it wasn't until the end of my foray with this nacho with chili and cheese, basically they have the tortilla chips in a case and then you go and pump your cheese and chili onto it. I can picture it. But towards the end, I got this idea from a friend about go and crack open a bag of Doritos and then pump the chili and cheese into that bag.
Yeah.
Right? So, oh my gosh, it got really bad.
That is next level.
Wow. Heartburn. Yeah. And and what I would do, I would call my mom, Mom, she's like, just drink a white soda.
You know why you went back? It's because they put those addictive chemicals in it where your brain literally, and it happens, it's not just the gnarly 7-Eleven cheese or whatever that is. It's in the foods at the store, right? So I mean, that's a very poignant, gross example, right? But that happens all the time to us in a way that's not quite as obvious. It's like, oh, why do I keep eating this food, and it's because it's actually not food. It's just chemicals that are training our brain to be addicted to it.
Yeah. And what if I could just take a pill so I don't have that experience?
Perfect.
Even though my body is setting off the fire alarm,
Totally. Oh,
like,
gosh.
stop putting this in here.
Totally.
You know, that's so nuts.
Yeah.
We're nuts, but it's okay. We're getting there. So speaking of getting there, let's talk a little bit about what we should be looking at. You know, as far as, you know, you've had a very up close and personal experience with our healthcare system and our dependence upon pharmaceutical interventions, which again, drugs have their place. And especially as you mentioned, for acute situations, I'm a big fan of some of the things we're able to do, our emergency medicine, but our treatment of chronic illnesses is absolutely horrendous. It's terrible.
Right. And
the Journal of the American Medical Association published a meta-analysis. This was 2018, and they determined, guess what? Poor diet is the number one cause in their analysis of our epidemics of chronic diseases.
Right.
Those being heart disease, obesity, diabetes, etc. We know this is the thing, but we're not doing anything about it. This is why folks like yourself and your platform and platforms like this are so important, because the thing is, I know, and you know this too, people want to feel good. They want to be healthy.
They do.
But they're oftentimes not connected to the right data. So let's talk about some of that right data. You know, why is our nutrition, we've touched on a little bit, but why is food such a big component of our health and being able to avoid some of the downfalls in the healthcare system?
Right. Well, I mean, food is literally feeding, like our body is the result of the food we eat. And so not only just maybe physically what you're looking at, or maybe your skin health, right, or weight, I mean, that's like an obvious thing that you can see, but the inner workings of our body, the protein that we eat is the building block of so much of what's going on in our body, right? So I think that, you know, when we're eating food that's not food, and it's, you know, these packaged and plants, and we put it in our bodies, it's just disrupting the, you know, what I say is God's design for our body, the way that everything is flowing. I mean, I don't even think we really fully understand the human body, of course. I mean, it's just an insane cascade of chemical reactions all the time. And so when we eat foods of the earth, meat from animals, it actually is just fueling our body how it was designed. I just, on one hand, I love all the data behind it. I love it when you see data on this food helps with this, and, you know, beans help with this, and potatoes help with this, and meat helps with this. But on the other hand, I'm just like, it's actually so basic and primal.
Yes.
So sometimes I'm just like, yeah, I love this data. Foods to support your liver, foods to support skin health, foods to support heart, all these things. No, it's actually so basic and common sense. And so that's what I always want to encourage people is, I mean, you could research all day long about the clinical benefits of food, real food, on losing weight, getting, you know, being actually heart healthy, not from your cereal box, on all the things, right? You know, reversing type 2 diabetes. But when we come down to it, we just have to maximize eating real food. And it's simple, but it's a really big step for a lot of people. And so I would just say for anyone listening is, you don't have to go from like eating 90% processed food to, you know, 90% real food overnight. That's a pretty big switch if you want to go for it. But take baby steps to be stepping into just eating real food. That's what our bodies run on. I love it so much. I get passionate about this because it's so good. It's so common sense. I mean, it stands the test of time, and your side effects are only positive. I mean, you could take exercise even. Exercise is just as effective as antidepressants. But you know, we don't see that clinical data. And to me, that's common sense. And I love that the data supports it. Yeah. But it's like, wow, I mean, it's just incredible. So
you just said it. It is actually in the data affirming that movement, exercise is equal, if not more effective than some of our best antidepressants. Now, why is there not a vested interest in getting folks to move more versus getting folks onto very expensive medications? And you might not be personally paying out of pocket for that drug, so you think, you know, but this is a big economic drain because that money's coming from somewhere. And so it might be invisible to you, but it's still funding this big machine, you know? And so why on earth would we have somebody to go and move more and reduce their symptoms of depression versus making a little bit of money, you know?
Right.
So this is why folks don't tend to see publications, you know, again, prestigious,
no one's funding
peer-reviewed
it.
journals. Yeah, exactly.
Yeah. Let's
So
do it. Let's fund it. But, you know, I think the reality is there will always only be these massive RCTs done by pharma. So anything that's outside of that realm, natural, holistic, even if it's, you know, like a supplement that's natural, you know, people are like, well, there's no evidence. Well, there's not going to be, because it's not funded by, you know, one of the richest entities in America, big pharma. So
right. You know, the good news, we do have some scientists asking these questions, but like you mentioned, it's a funding issue for sure. But you just said it. Here's the big news. This is the big headline. And this is going to sound a little crazy. You said it. These are the words. It's basic. This is so basic.
Yes.
And so just paying attention, asking a simple question: what do my genes expect me to eat? You know, what have humans been eating the longest?
Right.
Very simple. You just listed some real whole foods. Chances are this is going to have better outcomes than the nacho with chili and cheese.
Right.
You know, just very basic. That is so basic. But yet for people, we're at the level below basic, or 10 levels below basic. Or we're in Godzilla land here in Middle Earth, basic, burning, and don't even realize how basic this is to find out what is probably going to give you a better health outcome.
Right. Yeah. And I always just say, like, you know, you can dig in the data, you can research all day long, you could get into all the amazing biochemistry of real food and movement and sleep. And I love that. But if you don't just realize that these foundations, if we just don't do them, you're not going to feel great. I mean, I love how it can be both very complex and, you know, interesting, but it's also so simple. I mean, even for myself, if I'm like, man, I'm not feeling so hot last few days, like, am I taking care of myself? Have I been moving my body? I need to go to sleep an hour earlier. Like, it's like that for all of us. And we all get the chance to decide every day what we want to do with our body. And I love that.
Yeah. And by the way, and this is another great point of emphasis, is that you are doing these things with, you got 3 boys, 3 young sons.
They're like a workout too. It's helpful.
So finding a way to, you know, feed your family, to create a culture, a culture of health within your family structure with you and your husband.
Right.
So let's talk about that a little bit, and the culture you've created, because when I follow you and check you out, you guys are often doing things that are active. You guys are like hiking together and going on adventures, and of course eating good food along the way. How are you able to get to that place from a place that's, you know, again, very basic, where people below basic? If somebody's wanted to get to that place, you know, say again, they've got small kids and they've got a lot going on in their lives, what are some of the things that they can do to create a culture of health in the family?
Right. You know, I think in our society today, we love kind of the easy way out. And with kids, it's easy to not get outside, to not go on road trips, to not take a hike. It's easier to put them in front of a show. I mean, right? I have 3 boys. They have so much energy. But what happens when we actually do that with our kids, not only with them, but model it, is they realize how awesome it is and how fun it is to mountain bike, or to go on a hike, or to do all the things that we actually love doing. And it takes more work with kids. That's hands down true. But I think in the end, you're kind of cultivating this, you know, a family culture, a family habit of not sitting and screening and, you know, snacking on chemicals. You're out in the earth, right? We jump in alpine lakes. We do all these things with our kids because it gives us life, and we see that it gives them life. And yeah, we're normal people, and we have movie nights every now and then. It's like we don't only hike all day long, right? But I think it's just taking those baby steps to get your kids out. I mean, I think literally just getting kids outside could be like a major step for a family if you're not there yet. That to me is huge. And then when it comes to food, you know, I actually really think that kids, well, they of course, we're modeling to them, and I think that's huge, what we eat. But they're smart, and they actually know what good food tastes like. And so if we're constantly giving them chemicals, their taste buds are going to think that that's what tastes good. And if we're giving them food that's real more, I mean, we're not perfect, but I always think like 80-20, 90-10, something like that. then they're actually going to desire it. I mean, my youngest is sick right now, and twice a day now, smoothie. He wants a smoothie. Is a little immunity boost smoothie that I make him. Tastes good. It's perfect, and that's what he wants, and that's what he craves. And I just think it's those little baby steps. If you're not there for the full force, just change 3 things and see how you feel. See how it changes your day. See how it changes your kids. I mean, bless the kids. They're on so much processed food, and it's a driver of ADHD. It actually, I read that the amount of processed foods is changing the mineral absorption, and it's tied to autism even. So the red dye, the processed food, it is literally changing our kids, not just their, what their weight or their health in that way, but it's changing their mood and their brain and their entire day. So I'd say if you could just get them outside and more real food.
Yeah, I love that. And unfortunately, even the label of autism can be a little bit controversial or radioactive for people to talk about. But what I want people to think about is, and this is a fact, look at how the rates of autism have skyrocketed in the last couple of decades.
Yeah.
Something happened. There's something going on. Something is wrong here. And we have a lot of data on what those things likely are.
Right.
And it's probably not one thing. It's probably a combination of this very abnormal life and structure and exposures that our children have, that we have. Right. And so, I want people to think about that a little bit. And also, being that during this time with this virus and all the changes that have happened, these societal changes, and I'm going to talk more about this because I've got several studies now on my desk indicating how the rates of obesity have just jumped up radically in children specifically.
Yes. And depression.
Right. That too. When I break this stuff down and actually show people the numbers, it is shocking how quickly things have got so much worse. And so with that said, and the paradigm that we're existing in right now, what are some of the things that you feel are not getting enough attention? What are some of the things that you feel we can actually be doing right now to make our citizens more resilient, to protect our children in a real, sustainable, ethical way?
Right. Yeah, I feel like from a media, physician, CDC, healthcare perspective, there's the one focus, right? It's like all we can talk about. And I think we can go there if we want, but it's such a tiny component. And I think to me, it completely misses the mark of the fact that besides all the data around it, how we treat our bodies is going to impact how we respond when we meet any pathogen, whether it's COVID, influenza, or like the trillion other viruses out there in the world. So I think just like what we've been talking about today is it's the foundations. And so, whether it's you're not eating real food, that's a perfect opportunity to change what you're eating. We know that, of course, diabetes and obesity and all that is impacting COVID outcomes. So, even if COVID's gone in 10 years and your kid's 10 years old, there's still so much that is positive from making these changes in our kids and in our families. And for me, when it comes to COVID, it's just like everything else. It's about the foundations. So sleep, like you said, is huge for the immune system. Movement. I just love movement and sleep. Like you get increases in the cells in our immune system that are fighting infections. It's amazing to me. So yeah, I think you could take a biologic every 6 months, but if you're sick as all get out, or your gut is messed up, or all the different ways that your body could basically be kind of like dying inside, you're probably not going to fare so well. And so whether or not the population is doing what the health experts are saying, we're so sick that it doesn't even really, it's not going to make a dent. Because as a nation, we are very sick, and we're dealing with a virus that is basically impacts the people in our nation that are that way. And so I would just encourage those people and everyone to create a strong terrain, not just because you don't want to get sick with COVID, but because you want to feel well. When I wake up, it's not like I don't eat well because I don't want to get sick from COVID. I eat well because I just feel better that way. Like I have more energy. I can have energy for my kids. I can do all the things I want to do with them. I have energy to make them a real food dinner. It's like COVID isn't my driving force. So I think I want everyone to realize that, yeah, you're going to see better outcomes with COVID. As a nation, we would, but we'd also just feel better. We wouldn't be depressed. I mean, the kids, the AAP just said finally yesterday that there's like an emergency crisis now of depression in kids, teenage suicide, and girls doubled suicide attempts. So I think, just the fear and the isolation and the screens and, basically living life how we should not be living is having a terrible impact. People become depressed, then you eat more, then you watch your screen, then you feel lonely. I mean, that is not what we're here for. And so if you can get out of that cycle and step into how we're designed to live, that's where you'll thrive. And beating COVID would be just another positive.
Yeah, absolutely. Meg, this has been so insightful and helpful. And thank you for bringing that up because, again, that's hot off the presses with this being acknowledged, which we could see it coming a mile away, all the isolation and the all these mandates, the impact that it's had on our children has now been put into this state of emergency or crisis to address these mental health issues. And so, thank you for being the example of what we can be doing. And I encourage people to follow you, of course, on Instagram is one of the best places. So can you let everybody know where they can follow you and also just where they can hang out with you and learn more?
Sure. Yeah. So on Instagram, it's kind of a mouthful, but it's a whole health life. So and then the word whole health life, a whole health life. And my website's awholehealthlife.com. So, but yeah, if you find me on Instagram, that's where we can connect.
Awesome. A Whole Health Life. And we'll put that for everybody in the show notes, of course. And again, I want to thank you so much for being an advocate for all of us, for doing the hard thing when it wasn't popular.
Thanks.
And I just can't wait to connect more to see what you do next. And I'm just grateful for you being on the planet at the same time as me.
I love it. Thanks, Shawn. Well, it's truly an honor to be here.
Hey, if you like this video, make sure to check out this video right here to up-level your health today.
We have kids that are out of school, they're on Zoom, they're getting more overweight, they're learning bad habits, they're spending time on screens. Like, these things have unintended harms. And so just like we look at health and nutrition, let's look at the root cause of what's making people sick and what can we do to sustainably make them more resilient.